taking proactive measures to address and contain any possible spread of the disease. The epidemiological investigation on the index case is ongoing. The 19-year-old deceased inmate was admitted as a remand detainee at Medium A, B section in December 2022. He appeared in court on the 20th of October 2023 and was transported back to the facility. When the inmate showed signs of not feeling well, the Correctional Services healthcare officials treated him, and the decision was taken that he be transferred to an outside hospital. At the time, the inmate showed malaise and respiratory symptoms, hence the transfer to Victoria Hospital on the 28th of October 2023. He received further treatment and was tested for diphtheria, and the results came back positive on the 2nd of November 2023. Unfortunately, the inmate's condition deteriorated and he sadly passed away on the 5th of November 2023 at Grooterskuur Hospital. When the diphtheria diagnosis was confirmed on the 2nd of November 2023, the Department of Correctional Services immediately started with the contact tracing exercise in an effort to identify individuals who may have been exposed to the infected inmate. The Department of Health in the province of Western Cape was also informed, and it is important to acknowledge the urgency at which the department responded and sprang into action. A total number of 54 remand detainees from B section Medium A were identified to be contacts with the index case. They were immediately isolated and the baseline assessments were conducted. From the 54, as already stated, a total of 8 tested positive and 46 tested negative. We have 15 Correctional Services officials that were identified as contacts, with only 3 presenting symptoms. They were tested and released to isolate at home. They continue to receive support and monitoring from the Department of Health and our officials as they are isolated at home. The provisional results have since came back negative, and we are awaiting confirmatory results. As the department, it was important that we act with necessary urgency. The health and well-being of our incarcerated inmates, our staff, and the surrounding community are of utmost importance to us. We are obligated to ensure a safe and healthy environment. We are dealing with diphtheria, which is a serious bacterial infection that can be transmitted through respiratory droplets or direct contact with an infected person. Recognizing the potential risks associated with communal living, we have implemented a comprehensive set of measures to mitigate the spread of the disease within a correctional setting. We are doing this because we also know that diphtheria outbreak in a correctional environment requires a coordinated and comprehensive response in order to contain the spread and provide appropriate medical care to the affected individuals. Key measures that we have conducted as the Correctional Services here at Pollsmoor includes the following: a vaccination campaign. We initiated this campaign to ensure that all eligible individuals receive a diphtheria vaccine. Vaccination is a proven and effective method to prevent the onset and transmission of disease. A total of 342 inmates have been vaccinated, and also we have 36 officials that have also been vaccinated. We also have heightened our hygiene practices. Inmates and staff members are once more being educated and encouraged to practice enhanced hygiene, including regular hand washing with soap and water, covering mouth and nose when coughing or sneezing, and the use of hand sanitizers. Our facilities are being deep cleaned in an effort to minimize the risk of disease transmission, and this involves pest control. Of course, we have issued out the inmates in this section and our officials with masks as a part of the preventative measures. Another measure that we are implementing is isolation. We are effectively on day 16 of isolation to those defined as direct contacts. This is done in order to prevent further transmission. Appropriate medical care is also provided to those classified as high risk and those with mild symptoms. Regular healthcare screening is also another measure that we have put in place. Inmates and staff members are now subjected to regular health screenings to detect any potential cases early. An action of this nature shall enable us to prevent the spread of the disease and be ready to deal with new infections should they emerge. Of course, we are also providing medical attention as a comprehensive measure. Our healthcare professionals are readily available and they are treating affected inmates. Appropriate medical treatment is also being offered. We work with the Department of Health very closely, as I've indicated, in ensuring that a comprehensive response plan that we have put in place is implemented. I should indicate also that we did not struggle to access vaccination resources and other expertise that we needed. And for that, we are grateful and we applaud the Department of Health. We are leaving nothing to chance. That's why I've indicated that we're emphasizing on health education, especially on the side of inmates and our officials. Also, the service providers that access our facilities are screened for diphtheria. And we also continue to emphasize the importance of vaccination and also, as I've indicated, the importance of ensuring that we amplify preventative measures. Our healthcare team is vigilant in monitoring the situation, and the infection prevention measures are for every individual in a correctional facility to follow through. I must emphasize that the situation is calm and under control. I have visited the inmates that are in isolation. I visited the center where the first case was identified. I've also interacted with the management of the area and also the correctional facility. So far, there are no new cases that have been reported in the past 5 days. Hence, we do believe that the measures that we have put in place are effective and are ensuring that the well-being of all those who are around the setting of Pollsmoor is taken care of. But just allow me to reiterate that diphtheria is a vaccine-preventable disease. And through comprehensive measures that we have put in place, we aim to minimize the risk of transmission at the Pollsmoor Correctional Facility. I thank you.
Thank you, Commissioner. Colleagues, that was the statement by the Commissioner. I would want to open the floor in case there are questions. If not, it means the Commissioner was very clear. Can you open the floor? Do we have any questions? There's one. Okay, okay, two. Okay, in that order, just introduce yourself and the media house that you come from, and then ask the question.
Morning, Commissioner. I'm Jenny. I'm from Independent Newspaper. My question is, you mentioned that the prisoner had been at the courthouse in October. Which courthouse is that, and how is that going to be managed? Because that was outside of prison walls.
Okay. The second question.
Commissioner Aisha Ismail from eNCA. You mentioned that 342 inmates and 36 officials have been vaccinated. Why are you not vaccinating everybody in this facility?
Okay. So I'll go with that too, unless there's appetite for another one. Okay. The colleagues who are joining us online, you will have to WhatsApp me your questions, and then I will then read them out to the Commissioner. So for now, let me ask the Commissioner to respond to the question, or you may also decide to delegate some to the other colleagues. Thanks, Commissioner.
Yeah, thank you. Well, the inmate appeared at Mitchell's Plain Magistrate Court, and I've indicated that we're working with the Department of Health in ensuring that we manage this outbreak, and also we work with the departments that are part of the Justice, Crime Prevention and Security Cluster. That would be the Department of Justice, that would be the SAPS also. So it's a collective effort in ensuring that the value chain of infection is broken. On the issue of 36 inmates and vaccinating, why not vaccinate everybody? Next to me here is the Deputy Commissioner responsible for healthcare services in the whole of the Department of Correctional Services nationally. So she's better placed to answer that question. DC Mabe?
Just to through them.
Thank you very much. Like Commissioner indicated, that diphtheria is a vaccine preventable disease. So those that were vaccinated were those in need of the prophylaxis according to the disease, and those not vaccinated are not needing the vaccination at this stage. And hence it was indicated that we are monitoring the situation closely and ensuring that the relevant preventive measures are in place. Thank you.
Okay. I'm not sure whether I would want to take a second round. I see there is one hand up. Colleagues, this is the last round. So over to you, ma'am. You may shoot. Yes.
Commissioner, has the diphtheria only been detected at Pollsmoor Prison so far? And are you looking at other prisons or correctional services facilities across the Western Cape? Just another, if you allow me to ask another question, please. Do you think that this could have been prevented had you acted sooner?
Okay, second question, yes, ma'am.
Just to follow up on my first question. Court cases and court attendance, how was that being managed? There was a given backlog.
So come again.
Court cases of prisoners, those that are in isolation, and
oh, how do they
jail
attend to?
yeah,
Okay,
in jail
no, we hear that. How do they attend to other measures? Okay, I see there's a dead hand and probably the last. Yes, ma'am.
Mariska Botha from the SABC. We know that Pollsmoor is overcrowded. The Regional Commissioner Klaus has been very open about that. Is that of concern for you at the moment? We were speaking about making space to allow people to isolate and get distance. How do you do that in a facility such as this where overcrowding is a major issue? Thank you.
Okay, thank you, colleagues. Commissioner, over to you and your team.
Okay, thank you. Well, the outbreak is only at Pollsmoor Correctional Facility. I must indicate that our correctional facilities, since the advent of COVID-19, have been put on high alert when it comes to hygiene, and also putting up measures that would not open our inmates and our officials to infections. This is the strength that we have developed as part of how we successfully managed COVID-19. So it's a practice that is continuing. So yes, the correctional facilities in the Western Cape have been put under high alert, but as I've indicated, this is a strength that we've built over time. Yes. And yes, we did act sooner. And if you go through the facts and the types of steps that we have taken, you will realize that we only have one inmate having lost his life. It's regrettable, yes, but we were able to prevent any other loss from then on. And we are vulnerable to these types of infections, of course, as a correctional facility, because we have a remand detection, a remand detention section. So the inmates in that section are on high rotation. There's high mobility. Inmates go to court every day. They come back. We accept new. We screen them where there are symptoms. We act quickly. This inmate, we did not pick up any symptoms. I mean, this inmate was admitted in December 2022. He has been going to court, and as I indicated, the last time he went to court was on the 20th of October, and that's when we detected. And we acted with the speed that it required. We activated also the Department of Health. In terms of the court cases, we work very well with the Department of Justice. We have put measures to postpone the appearances, in principle, until the end of the month of November. But for specific cases, we submit to the magistrates and the judges so that we follow the procedure as required by the law. Overcrowding continues to be a concern, especially in the remand detention section. The success of the criminal justice system is measured on the basis of arrests that are made and the number of sentenced inmates that we have in our correctional facilities. Now, with regards to Pollsmoor correctional facility or management area, as I've indicated earlier on, that I have been through the isolation infrastructure and also the hospital infrastructure here, I must indicate that we have quite adequate space. All the isolated inmates are comfortable in the hospital wing that we have here at Pollsmoor. These are infrastructure resources that we put in place during the time of COVID-19. So our capacity, as I've indicated earlier, continues to be a capacity that is set for any type of a disaster or an outbreak of a disease that we can face as a correctional facility or in a correctional setup. So we are quite comfortable that we are able to manage the numbers. Even if they can increase, we'll be able to manage them. But as I've indicated, we have controlled them to a zero outcome in the past 5 days. So we are counting.
Okay, colleagues, thank you very much. We've come to the end of our briefing. I know there is 2 colleagues who asked for a one-on-one. You grab my pocket immediately when you leave here. But on that note, National Commissioner and your team, thank you very much. Thanks, colleagues.
No, you can do yours and then I'll... Yeah, you do yours first and then while you will...
Which courtyard? This one?
Yes.
That's all fine, yeah. Do you need other languages, girl?
I just want to check with them. Let me just... I'm not sure. I'm going to check with...
Okay, guys, you can set up in a minute.
Thank you. George, let's go sit up in the courtyard.
Okay.